Hello. Welcome. I'm Janet Curry, the director of the Center for Health and Wellbeing here in the Woodrow Wilson School, and I'm delighted to have the opportunity and the honor to introduce Angus Deaton, who's one of our most distinguished affiliates. Angus is the Dwight D. Eisenhower Professor of Economics and International Affairs at the Woodrow Wilson School, and he's also in the Economics Department. His main current research interests are in the area of health, well-being, and economic development. Angus has been awarded many honors. He's a corresponding fellow of the British Academy, a fellow of the American Academy of Arts and Sciences, and of the Econometric Society. In 1978, he was the first recipient of the Econometric Society's Frisch Medal, which is for the best paper published in Econometrica. He was president of the American Economics Association in 2009, and in 2012, he was awarded the BBVA Foundation's Frontiers of Knowledge Award. Angus was also on my thesis committee, but that, of course, is the least of his accomplishments. But it makes my pleasure greater at being able to introduce him. So his book, and there will be a signing after this, just to remind you. His book grows out of a long-standing interest in the determinants of health in rich and poor countries, as well as in the measurement of poverty. As Darren Acemoglu, who's at MIT, put it in his review of the book, there's nobody better than Angus Deaton to explain why our lives are longer, healthier, and more prosperous than those of our great-grandparents. This is a must-read for anybody interested in the wealth and health of nations. Another noted development economist, William Easterly, calls the book magisterial and superb. Actually, the word magisterial seemed to come up a lot in the reviews. A third reviewer, Ian Morris, explains, "The Great Escape tells the two biggest stories in history, how humanity got healthy and wealthy, and why some people got so much healthier and wealthier than others." Angus Deaton, one of the world's leading development economists, takes us on an extraordinary journey from an age when almost everyone was poor and sick to one where most people have escaped these evils. And he tells us how the billions still trapped in extreme poverty can join in this great escape. So without further ado, please join me in welcoming Angus Deaton.
Thank you very much, Janet. It's great to have a chance to talk about my book to this audience. Before I do that, I would like to say I do remember being on Janet's thesis committee. It was a long time ago. And I also wanted, for those of you who don't know, Janet's election to the Institute of Medicine was announced today, so we should start by congratulating her. So this book is about things I've been working on for a very long time, off and on. It's largely a popular book, and it tries to do these things that academics try to do all the time, and which turns out to be quite hard to do, which is to write for a broad popular audience while not having your colleagues laugh at you when you come to work for having got everything wrong. And that may be what I've done. So this book is about progress, and it's about inequality. And the great episodes of human progress are what I call the Great Escape, starting from a period when almost everybody in the world lived in material destitution, in ill health, and died much earlier than they should have done. And the movement, the escape, if you like, is to long life and to high material living standards, which many of us, though not everybody in the world, enjoys today. That's the Great Escape. The analogy, of course, is with the Steve McQueen movie, which I look around. When I say that, usually the people in the audience over about aged 55 nod and smile, and younger people have no idea what I'm talking about. It's a great movie about an escape from a German prisoner of war camp in the Second World War, which is actually based on a true story of a guy who'd repeatedly escaped and eventually was put in this very secure camp and led 200 people out to the escape. and through tunnels from the prisoner of war camp to the outside. I'll say a little bit at the end about what happens at the end of that movie, because it did not actually have a happy end. And we might hope that The Great Escape of Mankind will continue to have a happy end and not end the way the movie did. There's a few things I don't talk about much in the book, but which are really, really important, which are other things that have gotten better at the same time, like better governance, more people in the world live under democracy than has ever been the case in the past. There have been large-scale reductions in violence that Steven Pinker has recently written about, huge increases in education around the world. There are areas in rural Rajasthan where I've worked in the past where we would be interviewing people and no adult women had ever been to school or were literate. And if you looked out of the windows, you could see little lines of girls going to school. The schools were pretty crappy and they weren't learning very much there, but at least it was a start. There's also arguably increases in life evaluation, if you like happiness. That's under debate, but nevertheless, I think that's probably true. So here's a world in which fabulous things have happened. People have gotten out of these terrible places into much better places. But a very obvious fact about these things is that these episodes typically only allowed some to escape. They didn't allow everybody to escape at the same time. So that left many others behind. And in that sense, progress has been an engine of inequality. Unless everybody gets out together, huge gaps open up between those who make it out and those who don't. And this talk is about some of those episodes and what we're to think about the inequality that results. Inequality is a topic which almost everybody is debating these days. Most people, at least if you read the New York Times, think inequality is an unmitigated evil. That's not always the case, and I will talk about that along the way. Okay, so, So perhaps the most famous of these episodes is what historians call the Great Divergence. And this is what happened about 250 years ago when sustained economic growth began in Britain and in Northwest Europe between around 1750 and 1850. That sustained expansion in living standards and at the same time of life expectancy and improvements in health essentially sowed the seeds of the increases in material living standards and life expectancy that we experience today. That's where it all began. But it only began in parts of Northwest Europe. And that meant that Britain and Holland and Sweden and later the United States pulled away from the rest of the world, leaving vast areas of the world behind, not benefiting from those things. Now, when I first heard about the Industrial Revolution as a student in Cambridge in the 1960s, we were sort of told that, or the impression we were left with at least, was that these miraculous things happened in Britain and Northwest Europe, and the rest of the world, to use Joan Robinson's memorable phrase, were living on nuts in the jungle. There was this sort of undifferentiated mass of people out there who were poor and nothing had ever happened to. Modern scholarship has shown that that is just not true. China is the classic example of places which were very rich, or parts of China were very rich for a while. My favorite example is the one of Admiral He, who was sent out by the emperor in a fleet of very, very large ships to explore and conquer around the Indian Ocean. I mean, he sailed south and west. And he did so in the early part of the 15th century, about 80 years before Christopher Columbus changed the world by sailing across the Atlantic. Here's a picture, which is one of my favorite pictures. It's actually not in the book. This is one of Admiral He's ships. And he had, I think, 8 of these. So this is just one. Just an enormous ship. The little ship that looks like a mosquito in front of it is Columbus's Santa Maria that sort of changed the world. And it's sort of trivial in comparison with, and would have been completely blown out of the water with maybe 1 or 2 of the guns. And what's more is the Chinese ship was sailing 80 years before Christopher Columbus. So I know no better summary of the relative economic standing of Western Europe and China in the middle of the 15th century. So why didn't China go on and become the great powerhouse? Well, when Admiral Hay got home, the emperor was a little worried and thought these maritime explorations might get out of hand and establish a power base that would threaten his own. So he ordered the ships tied up. The ships never sailed again. They rotted in their harbors, and that episode never bore fruit. And this is the first, but by no means the last, where extreme inequality and toxic politics got in the way of human progress. So what happened in those countries was not, in Bengal or other examples, was not that there were not flourishing civilizations and sometimes great wealth, at least for a while, but that it was never sustained. So the scholarship nowadays is not just why the West, but why not the rest, in some sense. And that is still being worked on by many people. The other thing that I want to emphasize in this talk is that the gaps that were opened up in the beginning in the 18th century have really never closed. So that country by country, the gaps between countries are not really getting smaller even today. The gaps between people are narrowing a little bit because two very large countries, India and China, are growing extraordinarily fast, or at least until very recently they were. And that's brought a lot of people up into the middle class. But country by country, the spread of countries, the bubble of countries around the world has not really narrowed. Okay. So one of the parallels to the Industrial Revolution is in health. And life expectancy began to rise in Britain in the middle of the 18th century in parallel with the Industrial Revolution, both to some extent inspired by the Enlightenment and the application of reason to human progress. And this led to inequality, not just in incomes, but inequality in life chances, in life expectancy between rich and poor. Not just between countries, but also within Britain. This is what is nowadays called the gradient, which is the difference in health outcomes between rich people and poor people. So let me show you a remarkable picture that was first drawn by Bernard Harris in 2004. This picture shows life expectancy in Britain from before 1550 until after 1850 for more than 300 years. This is the great Tony Wrigley project that dug into the parish registers and reconstructed life expectancy for Britain over this period. You can see that the most remarkable thing about this is the sort of lack of any sort of sustained progress over this very long period of time. You can chop it up and find trends in shorter periods, but that's sort of an illegitimate thing to do. There's a lot of variability associated with plagues and smallpox epidemics and whatever, but by and large, it didn't go up much from the mid-30s through all this period. Now, Harris had the wonderfully smart idea of using the data on dukes, on ducal families, the aristocrats, who of course kept meticulous records of all their births and deaths. So you can put the life expectancy for the ducal families superimposed on this graph. Now remember, these dukes lived in enormous palaces, they were really rich, they had multiple houses, they had servants, they got as much to eat as they wanted to eat in a place where not everybody did that. And here's what their life expectancy looked like. It's the most remarkable picture every time I see it, which is like nothing happened. They were about the same as everybody else, and maybe even a little lower. Some people suggest that leading people into battle wasn't a very good idea. On the other hand, most of the dukes I know led from the back, which was a much safer thing to do. But for nearly all of this period, for more than 200 years, there was really no advantage, no health advantage to being a Duke. So money didn't really help. And of course, the reason it didn't help is because there wasn't anything you could do. You're dying from the same infectious diseases, the same lousy sanitation as everybody else. And living in a big palace doesn't help you not get smallpox, for example. But after around 1750, something happened, and you get this enormous gap. Now, of course, you're hoping I'm going to tell you what did that, and I can tell you what some ideas are. No one knows for sure. Here's a bunch of things that seem to be important, and for me, the leading one of these is probably the inoculation for smallpox. This is 50 years before vaccination. So we're talking about inoculation, which is a technique whereby someone takes a lancet and removes some material from someone who's got smallpox and rubs it into the skin of someone who does not have smallpox, hopefully giving them a mild dose of smallpox and lifetime immunity. That technique was not known in Britain until the middle of the 18th century when it was brought back from Turkey by the wife of the British ambassador to Turkey. Other parts of the world knew about it earlier. So for the better part of 1,000 years, inoculation had been practiced in China and in Africa. It was brought to the not to the United States, it was brought to America, the American colonies, by enslaved Africans across the Middle Passage who knew about it and who explained it to the American settlers. So George Washington inoculated the whole of his army against smallpox, and all of the inhabitants of Boston were inoculated before the end of the century. In Britain, the royal family were the first. They didn't have any human subjects protection on those days. So the king grabbed some what he called abandoned children and a bunch of condemned prisoners. The two groups, of course, now were not allowed to do anything with at all, and subject them to this thing, and they survived. And so then he inoculated his own children. And it spread very quickly through the aristocrats. Cost a lot of money in those days. There's a list of other things that historians think were important. The thing about these that I like so much is that apart from the last one, they all came from abroad. We think of health innovations as spreading from the rich world to the periphery. These ones came from the periphery to the center of the world and were known in many other places. So all of these are benevolent, they were expensive and later spread more widely. It obviously would have been better if everyone had gotten them, but that may not be possible to do. So these health inequalities, which open up as a result of progress, you get this big inequality in life expectancy, is something that signals further progress to come, and that's surely a good thing. Provided, of course, it happens, and it may be that for some structural reasons, some people never get these innovations. Let me show you this picture. This I think of as a Princeton picture because Sam Preston drew this in Princeton in 1975 for the first time. This one's updated to 2010. And what it shows along the horizontal axis is income per capita in price-adjusted units, so you can compare it across countries, and life expectancy at birth for both sexes up the vertical axis. The black blobs are for 2010, and the gray blobs are for 1960. And there's two things. This is what I call the onward and upward graph, suggested by the arrow there. And that onward and upward suggests that life is getting better, both in terms of income and in terms of health. Not uniformly so by any means, but it's getting better. The blobs are countries, and the areas of the blobs are proportional to the population of the country. So you can see China and India and the United States up at the top right, occupying its unenviable position of having much worse health than it ought to have, given how much money we all have. This graph shows really three things. If you look along the bottom, there's just enormous inequalities in income around the world. There are all these countries on the bottom left, mostly in Africa, who have nothing, and countries at the top right, like us, who have $40,000 a year. Huge income inequalities between countries. There's also huge health inequalities from countries in the 30s and 40s up to countries like Japan in the 80s, for example. So there's big inequalities in both income and health. Second point is those are strongly correlated. So the countries that get good in one thing get good in the other thing. So not only are the rich countries rich, the people there get to live a lot longer too. And in the poor countries, the opposite is the case. The final point is just this upward and onward movement, that the curve in 2010 is above the curve in 1960. And that means that even if your income hadn't gone up, and in most cases it did, then you got better health. at least on average. There are obviously exceptions there. So I also wanted to, so I'm not at my optimistic best. I'm sort of going to back off now and be a little more pessimistic, because bad things, really bad things, happened as well. You don't want to think of it as uninterrupted progress. Here's a picture. That's the 1960 curve you just saw, and it's drawn in the same way. And there's two innovations. One is I've just hollowed out the balls so you can see them. The red blob is South Africa. And I want you to focus on two things: the big circle on the bottom left, which is China, and the red blob, which is South Africa. So if you go from 1960 to 1970, look where China is. It's 35 in 1960, and it's over 60 in 1970. You might have thought that was not possible, that you could have an increase in life expectancy of 15 years in 10 years. And of course, it is possible if you stop killing people. And what you're looking at there is the Great Chinese Famine of 1958-1960, in which perhaps 30 million people died. 40 other million people who would have been born were not born. This was essentially a man-made famine. There's no real evidence of any natural problems. And this was a political, man-made catastrophe of the greatest order. And modern evidence suggests that Chairman Mao knew pretty well what was going on and decided not to do anything about it at all for his own political ends. So once again, toxic politics sort of bringing down the world. So the other thing is South Africa, and this is going to illustrate another one of the catastrophes. Watch South Africa. South Africa is way below the curve because it's the mixture of a really rich country and a really poor country blended together. And so if you look at it over time, the rest of the world goes up, so does South Africa. And South Africa by 1990 is getting a handle on getting up towards the curve. Apartheid is breaking down. Africans are being treated better, and all that. And then in 2000, it just falls off the end of the world. And of course, that's the other great catastrophe of the second half of the 20th century, which is HIV/AIDS. And you could draw a very similar picture for Kenya, for Uganda, for Tanzania, for Malawi, for Zimbabwe, Botswana, all of which lost almost all of the gain in life expectancy since the Second World War to the epidemic. Things are improving a little bit now, but we're not there yet. So this is the picture. These things that look like organ pipes, these show in different dates from 1950 through to 2005, just the dispersion of life expectancy around the world. And you see it's narrowing. The bar across the middle is the median life expectancy in the world. The top and bottom of the pipes are the 25th and 75th percentile. And so the length of the pipe is sort of a measure of inequality, and inequality has been getting less. Now, many people, especially economists, think this is a great triumph of reduction of inequality around the world. It's, of course, largely due to the fact that many children's lives have been saved in poor countries, and there aren't many children's lives to be saved in rich countries. And by saving a child's life, you have a much bigger effect on life expectancy than saving an adult. And so a lot of that shrinking is just to do with that. And to say whether this is better or not, you'd have to answer the question of whether it's better to save a 3-year-old or better to save a 50-year-old. And no one has an answer to that. Well, people have answers, but they don't persuade everybody else. This is also one of my favorite pictures. This shows heights of women around the world. Each blob is a birth cohort, like the cohort of women born in 1945. And the horizontal axis is the income in the country in the year in which they're born. The main thing you can see here is this taller and richer up the top. Women in Northwest Europe have gained about 10 centimeters over the last 35 years or so, which is a pretty amazing thing to have done. That's a little bit of an exaggeration because I'm taking the endpoints. And that is happening in most of the world. It's not happening in sub-Saharan Africa, but it's happening, albeit very slowly, in India and Pakistan. The other thing that comes out of this is the puzzle as to why Africans are relatively tall, though very, very poor, and why Latin Americans, for instance, tend to be very short, though they're much better off. So talk a little bit about progress in health today. Much of those is driven by medical or scientific innovations. The prevention and treatment of heart disease has saved enormous numbers of lives. There's also been reductions in smoking across the rich world, not in the poor world. Men much more than women, which has narrowed the life expectation gender inequality. The gap between men and women is smaller than it's been for a very, very long time. And most recently, another great hopeful sign is there's real progress being made against cancer. It's incredibly expensive, which causes all sorts of potential problems, but we can hope over the next 30, 50 years to see what we've seen for cardiovascular disease, for cancer. Let me skip these pictures. There's similarly, if you look at what's going on in the US today, a lot of the screening and especially the use of antihypertensives against cardiovascular disease have tended to widen health inequalities, since the rich tended to get these things first. They left people behind. Poorer people are less likely to be screened. They're more likely to smoke. They're less likely to be using antihypertensives. And the health returns to good health behaviors seem to be higher among the better educated. Now, many people find this progress deeply disturbing, this opening up of health inequalities. It's not the sort of inequality that scares me the most, because by and large, these inequalities tend to open up at times of progress. And with luck, they signal that everybody's going to benefit later over time. But income, to me, is different. And I worry a lot about income inequality in the US today, though it has its good sides, too. So let me talk about that a little bit. We live in a country which, like much of Western Europe, has economic growth still, but decade by decade, those rates of economic growth are falling. That's one of the big facts that is not always sufficiently emphasized, and I think it poisons a tremendous amount of political debate. The world is much easier to handle when there's more for everybody, and you can log roll and buy people off. When there's not economic growth, that's a much, much harder thing to do, and it makes for much more conflict. Expanding income inequality, we all know about, you read about it all the time. And here are some positive sides of inequality, and the one that economists love to talk about is skill-biased technical progress, which means that technical progress in manufacturing, even in services, has favored those with high levels of skills. The skill-biased technical progress is itself partly in response to rising wages. But then that inequality, there's a bigger gap between people who went to college and didn't go to college. That incentivizes people to get educated, which causes rising inequality, which raises income inequality, though it's complicated by many other mechanisms that are going on. All of this provides incentives to more education, which increases educational attainment, at least for a while. So this inequality process, pulls people up. It spreads the benefits of the original partially induced innovation. Of course, there's a bad side to this too, because if you're not really capable of being educated, or you missed through bad luck crucial days in school when you were a kid, you're not going to get the benefits from this. So there's some residual inequality which goes with this, which is not so benign. But even if this were all that was going on, I think one could view it relatively benignly, just like the innovations in health. But as this debate, as many of you will know, has been completely changed in recent years by Saez and Piketty's work, who've gone back to look at the tax records. One of the things that people forget is we didn't really know what was going on at the 1%, top 1%, certainly not at the 1% of 1% or the 1% of 1% of 1%, because the household surveys had only 70,000 people in them. Bill Gates is never going to be in that survey. Warren Buffett's never going to be in that survey. You just don't see the very top. Whereas if you get the records from the IRS, you can see everyone, including the people at the very top, and you see what's happened. And that really changed everything, because we now began to really have data on the incredible increases in inequality that were going on at the very top of the income distribution, and discovered that the big inequality increases in 99% or above. There's been some, what some economists call polarization. There are many people at the bottom of the income distribution who are in non-offshoreable jobs. Think of nurses or people who work in the healthcare sector who've not done too badly. And so you have to look at like the 99 or above to 50 ratio, not the 90-10. And there's been some unnecessary obfuscation in that area, but it's pretty going on. Now, some is arguably skill-based technical change. Again, you know, like people found better ways of doing things. The trouble is, one of the better ways they found of doing things was making derivatives, and weapons of mass destruction, which is what I think Warren Buffett called them. And you know, the trouble is, in that case, the way the economists would think about it is the incentives are all wrong, and we're giving people huge incentives to do activities that are not socially valuable, meaning hurt everybody else. But much of it, and this is the bit that I think is really, really scary, is the consequence of inequality generating more inequality. And that's what's really of the greatest concern. And at this point, I should really hand over to my colleague, Nolan McCarty, who gave one of these lectures a couple of weeks ago. And he and his colleagues have done wonderful work on this. And these things are not as well documented, at least until this new work, than they have been. But the political side of increasing inequality seems to me absolutely central here. Many poor people cannot vote. Many people at the bottom of the income distribution have green cards and are not entitled to vote. Many African Americans are in jail and are not entitled to vote. Sometimes their franchise is taken away from them for life. There's the capture of regulators and of corporate boards, the lobbying for rules. The Glass-Steagall repeal was very much a study of that. The carried interest deduction, legislation written by corporations for their own benefit. Many years ago, Mansur Olson in The Rise and Decline of Nations talked about rent-seeking groups, small groups who could focus on a single issue and would have the incentives to destroy growth in order to promote their own sectional interests. And I think a lot of that is going on. Acemoglu and Robinson, in their recent book, How Nations Fail, talks about growth requiring innovation. Innovation requires creative destruction, and the rich and powerful elites will fear and sometimes frequently stop creative destruction. A good example would be when a pharmaceutical company lobbies to have a regulation passed to extend its patent, for instance. That's a way of blocking creative destruction from others. And as they get better and better financed, that gets easy to do. So we're back to Admiral Hay and the emperor. Now, some people, a lot of economists among them, say we shouldn't really care about income inequality. And if you ask yourself, why do you care? We might just dislike it and regard it as unjust. That's some people. We might just be jealous, and you know, it makes us unhappy that other people have more than we do. You know, it doesn't sound like a very noble feeling, but nevertheless, some people I'm sure do feel it. But economists have this criterion they call Pareto improvement, which says, look, if some people get better off and nobody gets worse off, why should you care? That's an improvement in the world. But the problem is that's wrong. And it's wrong because you can't look at well-being entirely in terms of income. You have to look at other things too. And if the rich people use their money to corrupt democracy, rich people don't care much about lots of public provision that we all care about and that we couldn't easily live without, like public health care, public education, Social Security, public pensions. The really, really rich don't care about any of those things at all. They care about having to pay for them, but they don't need them for themselves. So income inequality, extreme income inequality, which I think we're close to in the United States, is a negative force in all those dimensions. It may even stifle off economic growth for the reasons I've talked about already. Income inequality can be dangerous to your health, your education, and your democracy. So that's the scary part about income inequality. So politics. I'm running out of time. I just want to say, what can you do about this? You can participate in the democratic process. I mean, agitation in many places, participation are some of the solutions. Don't just sit there and let this happen to you. Let me end by talking a little bit about global inequalities and perhaps the most controversial part of the book. We've seen already in the pictures we saw these enormous inequalities in life expectancy and in income. Much of those are driven by infant and child mortality rates around the world, and they drive most of the differences in life expectancy. And I think probably everybody here knows this, but it's important, so let me say it again. That children are not dying of crazy exotic diseases that don't happen in the United States and which no one knows the cure for, which is what you read, if you read these books about viruses creeping out of the jungle and doing terrible things to people. That's not what we're talking about here. We're talking about kids dying from things that we've known how to fix for the better part of a century. Kids are dying from diarrhea, they're dying from pneumonia, they're dying from not being vaccinated when the vaccines cost almost nothing. Essentially, they're dying of the accident of where it was they were born. If you go to some of the big developing countries around the world, you'll get these enormous inequalities right on top of one another. Kids dying not far from gleaming modern hospitals. It's still true that half of all children in India today under the age of 5 are severely malnourished. I mean, they're more than 2 standard deviations off their growth curves, in spite of all the economic growth. And yet, the cost of fixing these things, as Jeff Sachs likes to remind us, is very, very small compared with sort of almost anything the government spends money on. That is, if you had those people here and you could do to them what we do to our own kids, it wouldn't cost very much. So it's hard to imagine a situation that presents a greater obligation to assist. And that would be true even if we'd had nothing to do with causing these problems, which through colonialism we had rather a lot to do with. So there's like, if you like, a double or strengthened obligation to help. I have no ethical quarrel at all with those who call for more aid, but I have a practical quarrel, which is that I don't think it works. Or at least, I'm going to qualify that, but a very important part of it doesn't work. So here's, first of all, I used to have this slide at the end, but by the end, people were hissing at me, so I moved this up to the sort of front. Because there's lots and lots of things that, quotes, we can do to help. Let me not go there. Well, maybe I will a little bit. The word we should, in economic development or in anything in the aid literature, is a very word and needs to be seriously deconstructed. Who the hell is we? Who put we in charge of doing this? Who are we? And when you say that to people, they get very unhappy and they move into the passive voice, which is one way of solving it. They say, people need to be developed or something. So here are things that we, and I'm seriously meaning citizens of the United States or people who live in the rich Western world, can do. We could do much more research on diseases of the poor, advanced purchase commitments, or start on that. At least one of those has been successful, meaning the government or the World Bank promises to buy so many million doses of a yet-to-be-developed drug. We could do much more in the way of consulting. The World Bank knows a lot of stuff, but it doesn't make that available to countries unless they're getting aid from it. So it's very dysfunctional in that way. They could provide assistance on trade negotiations, for example. When the US negotiates a bilateral treaty with, say, Honduras, the US on its side has dozens of incredibly well-paid lawyers from the pharmaceutical firms, whereas on the other side, there's a recent MPA from the Woodrow Wilson School who's doing his very best to level the playing field. Our trade policies are doing a lot of harm to people around the world, things like cotton subsidies. We do a lot of selling of arms. I mean, if you think about that for a minute, how serious can we about helping poor countries around the world when we're out there pushing arms on them? I mean, it's just absolutely extraordinary. There's all sorts of issues about recognition of odious regimes, about accepting their debt, about who can sell commodities, and about global public goods in general. So those are the things that I'm all in favor of, and I think we ought to do a lot more, and they would help. All of those things are what Jagdish Bhagwati calls aid for, not aid in, okay? So aid for means you're doing something in your own country which will help poor countries around the world, not taking money to those poor countries around the world and spending it there. And that turns out to be what is really, really problematic. This is also when Princeton students come to me, which they do all the time, with enormous dedication to the improvement of well-being around the world. And they say, what would you do? Where should we go? And I say, Washington, D.C. You know, that's where you can do the most good. Also, you have the legitimacy and standing to go agitate there. You can do stuff there that will be much better than what you might do somewhere else. So here's the key arguments, or the key argument. I think this is where I'm going to stop, yeah. So I just want to give you this main argument. There's lots and lots of other arguments in the book, and this is the longest chapter of the book. So I spent a lot of time pulling these arguments apart one way or another. But it's not about money. This money is what I call the technocratic, or the hydraulic illusion that fixing countries is like fixing a car or fixing the plumbing. You just, put water in one end and it comes out. It's not like that. It's true, as Jeff Sachs always likes to say, that better health and, say, better education and other services in poor countries could not be achieved with the amount of money that's being spent now. That is true. The trouble is, it wouldn't be better either if you spent more money on them now, because it's not about money. What it's about is chronic lack of state capacity. I see my friend Jeff Hammer up there, who's written on this about health in India more than just about anyone else. And in India is a perfect example of that. The state is not capable of running a health service on its own, nor is it capable of monitoring or properly regulating a private health sector. So you finish up with two health sectors which are very different, each of which are disastrous in their own way, but in very, very different ways. And the problem is not lack of money. You just have more of the same if you had more money. And the way I find it helpful to explain to people here is we hate our government in the United States for good reason, or many people do. But you want to think about a bit as to what would happen if there really was a total government shutdown, not just the federal government, but all the local state governments, all this stuff. Then, and most of us have bought into that bargain. We pay our taxes, albeit a little reluctantly sometimes, and in return, we get an enormous list of stuff. And there's some of those things there. Most of those, we just could not live our lives if we didn't have those things. And indeed, one way of thinking about it is, if those things were taken away from us, it would be like moving to a poor country. So what's really missing in a poor country is just this effective contract between the government and the governed, in which on one side they pay taxes, on the other side they deliver some sort of services. That probably works best under democracy, but it doesn't have to be totally under democracy. Foreign aid in large quantities undermines this contract, makes it almost impossible. You've got many countries in Africa, dozens of them, where all of government expenditure is actually coming from abroad. It's coming from aid agencies. Those governments have no incentives whatsoever to raise money, to provide services, to provide health care, to provide education to their citizens. And until we stop doing that, that's going to go on. And it doesn't mean development's impossible, but it's certainly going to make it much harder and much more difficult. And I think it's true. You might say it's government-to-government aid that's the problem, but if you think it through, the NGO aid has almost all the same problems. Recently, after I'd written the book, and I should have done it before, I read a wonderful book by Duncan Green, who's the chief advisor to Oxfam, and it's called Poverty and Power, or From Poverty to Power, or Power to Poverty, I think. And I was reading this in order to sort of arm myself against the critics who I thought would come after me and was just stunned to the extent that he makes all of the same arguments I do about undermining government. And Oxfam has switched an enormous amount of its effort away from aid in towards aid for, and he's more positive than I am about ways of stopping this undermining happen, but he understands it extremely, extremely well. 3 days ago, I was in London and was invited to the development agency, DFID, and expected to be, crucified by elderly gentlemen who would say, I've been doing this all my life and you have no idea what you're talking about. But in fact, I got criticism almost everywhere else I talked, but none there at all. They understand this process very well indeed, because they're living with it on a daily basis. So I think we just have to back away from this. We should not be, a modest proposal would be that no country in Africa should get more than, say, 20% of its government revenues from abroad. Thank you very much. Bye-bye.
Thank you. We have time for some questions. We would prefer if you let students ask questions first, and then community members are welcome to join in. If you could come to the microphones, that would be great, because then everybody will be able to hear your questions.
This is not a student.
Robert Johnston. I'm actually Woodrow Wilson, 1970, and United Nations from then to now. I wanted to thank, of course, Professor Deaton for this remarkable research and book. I think this really carries forward and brings to the table some new terms and agenda for the development agenda as we see it at the UN and around the world. A lot of this has been in the works for a long time, but I think we're really beginning to turn the corner, so to speak, into developing a new program. My question is actually a little bit different from that. We've been in the midst of these poverty debates for 40, 50 years, actually. I date them to John F. Kennedy's formation of the Peace Corps on the steps of the Michigan Union in his famous speech in 1961, which he brought to the United Nations a year later. More recently, we've turned to the inequality debate. There's actually been, as we know, a lot of progress in the work on poverty in the last 15 years, and a lot of discussion of the statistics on that in the developing world. Now we all are acutely concerned with poverty, particularly in the United States, as Professor Deaton said. I wonder if there's not a lesson to be learned from a very important reference Professor Deaton makes on page 114 in his book. We know that extreme poverty he notes that extreme poverty in China was practically eliminated in a decade when agricultural prices and wages were significantly increased by the government. In this country, we don't pay living wages to our new generation of food providers, such as the fast food service, and the rest of the lower 40% in this country really doesn't get a living wage, and that's really a big part of the inequality issue. Of course, we're all outraged at the top, but this might be a way forward, and I'd be interested in his comments on that. Thank you.
I'd be all in favor of it if the political economy existed to do it, but I don't think it's there. Sorry? I'd be all in favor of increasing the living wage if there was a cat and hell's chance of it actually happening. But, I think, for reasons that Nolan and other people have talked about, the political economy at the bottom of the income distribution is not an accident. And it's very hard to do very much about. So,
Hi, I'm Hannah. I'm an MPA 1. I was wondering if your if your international model that aid for is better than aid in can be applied domestically, and would that suggest that food stamps or something is less effective than some other mechanism that could decrease nutrition issues at the bottom?
So thanks. I'm delighted you asked that question. I didn't really have time to expand, but I think of this as very much an international and not a domestic argument. And I very much want to dissociate myself from the view that sometimes get attached to me that, you know, the usual arguments against welfare is that you create welfare dependence in people. This is not about that at all. The argument here is about creating welfare dependence on governments, and it's the effect it has on governments. And so I don't think this goes through domestic at all. I mean, I might have views on that, and I hope we'll get a chance over the next year or two to talk about them, but that's not really what this is about. It's about what giving enormous amounts of aid does to the governments in poor countries, and I think that's a serious issue. I mean, you can think also of the chains of accountability are all screwed up because these governments are looking to the donors all the time instead of looking to their people. And then the donors get affected by, you know, there was an election in Canada a few years ago where they were talking about redirecting foreign aid away from HIV/AIDS to mother-child services. Well, you know, why shouldn't the Canadians have that debate? But why should people in Africa have their health care determined by some domestic political issue in Canada? I mean, that's some of the nonsense that happens when you have these very large aid flows. Thank you.
I have a question. Maybe it's more addressed in the book. I don't know. I think maybe you're underrepresenting the fact that the U.S. kind of corporate elite, who you say is writing the laws of the country, has a huge vested interest in keeping poor countries undemocratic, dependent on U.S. money and government, and basically ruled by industry. So, like, for example, the technology industry is really underpinned by the mining of coltan in the Congo, which is done under horrific conditions. If the Congo had a stable democratic government and a social contract with its people, they couldn't have those conditions and couldn't sell the coltan for so cheap, and the entire U.S. technology industry would have to reshape itself accordingly. And you could pretty much extend that relationship to any like blah industrial complex you can think of that requires foreign-sourced resources. So I'm just sort of wondering why you're making the assumption that the U.S. or the Western world, or at least the elite at the top of the inequality pyramid, even has an interest in reducing inequality, because it seems to pretty much benefit them.
Okay. I don't want to go as far as to endorse the analysis you just gave, but I did not mean to say what I think you thought I said.
I believe you.
So, so if you read the last chapter of the book, there's actually there's a section which is just on the anatomy of aid, in some sense, what it is and where it comes from. Many other countries around the world does not give aid primarily for humanitarian purposes. It doesn't pretend to do so. And it's clear that the domestic politics of that are extremely important in maintaining aid. And that's always been the case. And I give some pretty bad examples. I mean, there was one, according to historian Nick Callither, about Lyndon Johnson essentially manufacturing a famine in India, which didn't really exist, which was very convenient for him because he could then be shown to remediate the famine, which was good for his standing in the world, and buy a lot of food from his farmers at the same time. So that sort of thing happens all the time. I worry, though, in countries like Sweden or Britain, for instance, where that sort of stuff doesn't happen to the same extent. In that, for instance, in Britain, it's illegal to tie aid to local manufacturers, for example, which is only one of the things you're talking about, but it's an important one. What has happened in those countries is like people like Jeff Sachs, for instance, have gotten people so involved in their moral obligations to do something about Africa that they're determined to spend 1%, 1.5% of GDP on helping Africa, even in cases where it's doing the most horrible harm. Let me tell you one story, which is one of my horror stories. Last summer, I met a gentleman at dinner in Europe who told me the story about Goma, which many people here may know. This was after the Rwandan massacre, and when Paul Kagame swept in and kicked out the Hutu massacreists, or mass murderers, they went into the eastern part of DRC and settled in around Goma. There was a huge humanitarian emergency because there was no food or sanitation or everything there. The aid agencies moved in huge numbers into Goma. It became clear within a relatively short period of time that about 2/3 of the aid money was going to rearm the murderers who were determined to go back and exterminate the Tutsis that had been left behind. A few of the aid agencies, like MSF, moved out. MSF was vilified by the other aid agencies for leaving and mocked for saying, you know, you just wanted to be home for Christmas. But eventually, most of the big aid agencies like Oxfam and so on moved out because of the moral horrors of what they were doing. I asked the gentleman who was telling me this, I actually knew the story, but I asked him, what are you doing now? He said, I'm the head of foreign aid in my country. And I said, and how do you square that with what the story you just told me? And he said, people, my countrymen are so determined to spend money on foreign aid that I can't stop them. And the best I can do is mitigate the harm that aid is causing. I mean, what a horrible story. I mean, here is this guy, a dedicated humanitarian who wants to help the world, and he's turned into a harm mitigation officer. Anyway, please, here. Thank you.
Thank you for your talk, Professor Deaton. I'm Thomas Cohen, second year MPA. This is related a little bit to what you just touched on, but how I agree with your conclusion of how foreign aid undermines social contract in countries, but foreign aid is also allocated as a political decision. Right. U.S. aid operates in a political environment. And so I was curious if you could talk about how could you actually kind of transition how aid is given practically and a lot of it is also wrapped up into security assistance. Yep. And that also emboldens regimes to act in a certain way. I mean, Ethiopia is one of the largest recipients of U.S. aid in Africa. So,
I think countries, you know, are entitled to pursue their own geopolitical goals around the world. I just would like to stop them pretending to be doing it on humanitarian grounds, is one thing. The second thing is I don't know how to do this because there's no coordinator of this. And if, you know, Britain cuts back its aid, then the Germans or the Dutch or the Swedes will fill in, and then if they all step back, the Chinese are waiting there to spread all over Africa. So the best thing I could think to do was to write this book, which is, you know, maybe a weak answer, but I thought, you know, it might get to those places who say, you know, we have a moral duty to give 5% of GDP or 10% of our own earnings to the poor of the world. I don't think we have any moral duty to hurt people, especially people who are in very bad shape. So it's a limited tirade I'm making, but it's a tirade. Yeah, thank you.
Hi, Ben Horowitz, second year MPA. I'm wondering about the narrative about the informal sector in developing nations and how that's driving a lot of the economy and a lot of growth, yep. And how that sort of interacts with the need for a greater social contract, whether you see the informal sector is undercutting the ability to develop that social contract, and if there might be a way that aid could be targeted to address those sorts of issues without telling countries how to govern their economy at that level.
Except that's exactly what's going on. I mean, the aid is being given, and they're trying to change the governance, which, I mean, I think there's wide understanding among the aid or the enlightened parts of the aid industry that governance is really what's really important. And they're sort of thrashing around trying to do something about it, but I don't think they have a clue. Nor is it, I mean, they're really serious issues of violation of sovereignty and so on. And especially if you have power over those countries, going and telling them, you know, how they should run themselves. In the book, I give the example of maybe it wasn't a well-chosen example, of a Swedish delegation coming to the United States and saying, you know, we will fund Medicare for the next 50 years, provided you legalize gay marriage in all states and let all black people out of jail, right? Now, of course, whenever I say that in Princeton, people cheer and they say, right on, you know, we'll do that, you know, let them come. But, you know, maybe think what might happen in Texas, you know, with that sort of proposal. And so they're really, and especially if it's done under threat, you know, it's not just an option. And in most countries, these aid donors are not just an option. I mean, they're so deeply involved in the country. I'm not sure, I think the informal sector, like everybody else, needs a rule of law that actually works, and people, a police force that protect their property instead of preying on them and so on. So I don't think they're outside the social contract. There's a question up there. Here, yeah, sorry, please.
I'm interested in the shrinking middle class and if there are any historical parallels that you can see that would tell us where we're heading as a country if that continues.
It's a really good question. I don't know things off the top of my head, which doesn't mean there aren't any. But I mean, part of the issue, of course, is that many of these middle-class people have jobs that are very easily replaced by either machines or by people living in the Philippines or Thailand or something. And the people, you know, the people at the bottom have been protected a little bit because many of those jobs are service sector jobs that can't be outshored, offshored. And of course, the very top has been, so I think it may be specific, you know, to the period, or this particular, I mean, I'm not claiming this is the first time it's happened in history, but it may be specific to the age in which we live now. There's a question up at the back.
Hi, sorry. I don't think I asked that question correctly. Can I just try again?
Okay, but
really fast.
Cut the conspiracy theory.
It's not about a conspiracy. I'm just saying that the Western corporate elite, the most powerful force in the entire world, has an active interest in having resource-rich countries not be democratic and not have the social contract you described and keeping them poor. So I just don't really understand how you can kind of talk about how we should stop aiding countries, which I totally understand, and I do think that's a self-defeating thing, but I don't understand how you could not take that into account, that these situations are actively engineered to benefit a certain sect of a much more powerful group.
Okay. I thought I did answer that, and I agree. I don't agree with the details, but I agree with the broad thrust that many actors, very many powerful actors in the United States, have an interest in, you know, countries not developing. And they express that interest in the political process in the usual way. So I'm not against.
But I mean, shouldn't that be the major site of opposition to inequality because it's one of, if not the strongest cause? I just don't quite understand how you're prioritizing these things.
I'm lost, I'm sorry.
I don't understand how, like, it feels to me that that is a bigger cause of inequality than foreign aid.
I don't agree with you that the rich people are trying to hurt the poor people.
All right.
I think they're trying to help themselves.
Let one more person ask a question, and then I think we'll let Professor Deaton go and sign books.
I'm just wondering, you said when Princeton students ask you what can we do to make a difference, and you tell them to go to Washington.
Yeah.
And I'm really wondering how we can safeguard against going to Washington and becoming part of the clique and becoming part of the problem. And we have an excellent example the last few weeks of how someone from Princeton went and became more of a problem than a solution.
Well, his constituents in Texas may think he's part of the solution, not part of the problem. So, you know, and I mean, the sort of people I would like to see would come in for that sort of vilification too, but from different quarters. People always get sucked in, but some of them don't. And, you know, I don't know how you preserve people, give them the gift of eternal youth or something. There is one other way of doing it, and this is what I tell them. This is much, much harder, though. And I have a very good friend who I write with and who I've known for 30 years, who's an activist in India and probably has a reasonable claim to being the world's most successful activist. He was a Belgian. His name is Jean Therese. He went to India as a graduate student in economics and has very much thrown in his lot with the Indian poor. He became an Indian citizen, which is an extraordinarily difficult thing to do. He accepts no money from anyone. He lives off the very meager royalties he gets from writing books, and he wanders around the country in sandals causing trouble. He's been beaten up by the police more times than I can tell you. He's close friends with Sonia Gandhi. He knows Manmohan Singh extremely well. He and the people, the activists he works with, will take no money from outside at all because of the way it compromises him. He worries even about writing with me on the grounds that writing with someone who's a professor at Princeton by many of the people he works with is regarded as not sound. He petitions the Supreme Court. He and his, I don't want to say followers because there's no power structure in those groups, had the Supreme Court order free school meals throughout Indian schools for children. They had enormous success in getting passed the Freedom of Information Act, which is used to control corruption. And he has been instrumental in the recent Food for Work Act, which guarantees 100 days of work at minimum wages for every family in the country. So I think Princeton kids could do that too. But I say, it's really like the camel through the eye of the needle. You got to give up everything you have now and go and become one of these people. That's the only way you can have legitimacy and make this work. Okay, one last one.
Thank you very much. What impact are foundations like the Clinton Foundation and the Gates Foundation, that is non-governmental organizations, having on ameliorating some of the inequality?
Mixed, I think, is the answer. So I'm glad you asked that because they hadn't really come. I mean, it's clear that, for instance, foundations and NGOs and PEPFAR and the Global Fund, for instance, have played a major part in getting antiretroviral therapy to many people in Africa. And there are many people alive today who would otherwise be dead. And that is clearly a major improvement in the world. That has to count for a huge amount. So I'm not claiming that stuff is not doing any good. But in the end, these health services have to be run indigenously from the countries themselves. They can't be run from outside forever. Because if Gates gets bored and decides he's going to do something else, what happens to all that stuff? Or there's a Canadian election or something. And also it undermines the need of local people to agitate for the health service that they deserve. So with things like antiretrovirals, I put a 10-year horizon on there and say in 10 years, we're not going to do this anymore. And you have 10 years to organize, to petition your government to get those things put in place. This is closer to what happened in South Africa, where for a long time antiretrovirals weren't available. There was an enormous amount of agitation, in the end successful. That can be done elsewhere, but in the end, you can't have a health service that's run from outside the country. So that's really cool. Okay, thank you very much. Sure.